Welcome to the WPS YouTube presentation on pharmacy vaccine submission to Medicare Part B. We are providing this information based on a request from our customer service area. They have been receiving increasing phone calls concerning pharmacists and pharmacies submitting vaccines to Medicare Part B. The reason for this education is that recent uptick in inquiries received from pharmacies, and we want to assist the pharmacies in understanding the Medicare rules and regulations. We're still in the flu season. Pharmacies provide vaccines for flu, pneumonia, and COVID. Through the inquiries we've received, we've identified some areas where the pharmacy may need additional information. The first is the date of service. The date of service is the date that you actually provide that vaccine to the patient. You cannot submit it until the Medicare beneficiary actually receives the vaccine. One inquiry that we have seen is where the pharmacy states they have been paid, but the patient did not show. We set up an overpayment for that service. When the pharmacy, however, received that overpayment letter, they contacted us and said we needed to cancel the overpayment because the patient did come in at a later date. Well, we can't cancel the overpayment as that original claim was incorrect. They would need to refund the money and then resubmit a new claim with the correct date of service. Another issue is on Medicare enrollment. Pharmacies will use the 855B form to enroll in Medicare. You can enroll on paper. You can also enroll electronically. The instructions for completing this form are on the CMS website. The best way is to submit electronically. Submitting electronically allows the system to help you identify any errors or additional information needed before submission. For roster billers, and a roster biller is a provider who is submitting for more than one patient on the same claim. For roster billers, you can submit an abbreviated CMS 1500 form that allows you to submit one claim for multiple patients. Since people are billing most often electronically, this is not as common. If not billing through the roster, then you would submit the CMS 1500 form or the electronic equivalent. The electronic form allows for faster processing. Just like anyone else, pharmacies must complete the claim submission correctly. Enrollment in Medicare Part B is required for the allowed services. This can include the Medicare preventive covered vaccines. Other types of vaccines, such as the Tdap, may be covered by Medicare under the patient's Medicare Part D plan. Medicare covers the flu vaccine once per flu season. What's important about that is the wording. This is not once per year, but once per flu season. So for an example, the patient receives the vaccine in January, and then they receive another flu vaccine in October of the same year. Medicare can allow for both, as those are different flu seasons. Pneumonia vaccines are a little different. The general rule is once every 5 years. However, there can be exceptions. The patient may not know their vaccine status. There could also be more vaccines given based on the type of vaccine given. And then the COVID-19 vaccine can be provided once a year. There could be additional based on the patient condition and the vaccine used. Some are 2 doses. Here are some of the common denials that we're seeing for the flu vaccines, pneumonia vaccines, and COVID vaccines and their administration. The first is a denial based on the patient having a Medicare Advantage plan. The Medicare Advantage plan is their Medicare coverage. Any charges should be submitted to that Medicare Advantage plan rather than to Medicare fee-for-service. You can find this information in the Medicare transactional portal on our website. It will tell you if the patient has a Medicare Advantage plan and then the name of that plan. The second is that the service is not paid to this provider. As a pharmacy, you can enroll in Medicare Part B. Your Medicare Part D enrollment for the patient's prescription drugs is not the same enrollment. Enrollment as a supplier of durable medical equipment also will not suffice for Medicare Part B as in boy payment. The next is duplicate denials. This is where Medicare has received a second claim for the exact same service, same beneficiary, same provider, same procedure code. Before submitting a claim to us a second time, identify the status of that original claim submitted. You can use the transactional portal for this. It can tell you what happened to that original claim that was submitted. Keep in mind, when we deny something as a duplicate, we're indicating that we have already paid this service. So it may be that the claim payment was held for some reason, but you always want to investigate what happened to that original claim. And then the last bullet there is Medicare secondary payer. This is when the patient has insurance that is primary to Medicare. Again, this is available on our portal. If Medicare is the secondary payer, then you want to submit that service to the primary payer first before submitting it to Medicare. We've attached on this slide some resources for you concerning the Medicare vaccines. Again, the flu, pneumonia, and COVID. You can see there is the CMS Internet-only manual. There's a couple of publications there for you. CMS has a Medicare Preventive Services fact sheet that you can take a look at. There's information there on the pneumococcal vaccine and then the COVID vaccine toolkit. So we want to thank you for taking the time to listen to this information. Hopefully this will allow you to submit your claims correctly and for you to receive correct payment in a timely fashion. If you like this video, we would hope that you would like and share it. We also have a survey attached. If you would take a few moments and take that survey, we would appreciate it. Thank you for your time.